Thank you very much for joining us on the program.
My pleasure to be here.
So is the H1N1 virus around the world over?
It's mostly over in the developed countries in Europe and United States and Canada. It's still spreading in some other parts of the world where it came a little later. Some areas of China and some areas of Africa and Latin America.
And how severe would you say it is there?
I don't fully know, but it seems to be of average severity. And what's distinguishing about this strain of flu in this year is that it was a big outbreak. It's probably the biggest outbreak in 40 years. A lot of people became affected. It has a different age distribution than we usually see, many more younger people, lower mortality in general because it's younger people. But unfortunately, some very healthy children, pregnant women, and young people died from the flu. So like flu, it's a serious disease.
Would you say that most people who wanted the vaccine around the world were able to get it, and that governments and local authorities responded efficiently to the need?
I'd have to give the governments about a B+. They tried to get the vaccine to the people in a much shorter development time than usual. Usually it takes about 9 months to deploy a vaccine. They tried to get it out in 6 months. So that's very ambitious, and they didn't quite make it. And so most of the vaccine got out after the epidemic had peaked. It would have prevented a lot of infections if they had gotten it out earlier. But now, there's enough vaccine, I think, for everybody.
So on a scale of, say, 1 to 5, how would you assess the threat level? And also give us your thoughts on whether you thought that the threat was overstated.
No, I thought the threat was not overstated. And as we know that in the United States, at least 10,000 people died, including previously healthy children and young adults. So this was an important event. It went away a little sooner, and perhaps that has to do with vaccine and other measures. But it's now December. We've had a full flu season. It's December. I don't know what's coming in the spring. I don't know if it's coming back in the spring, or we're going to get the seasonal flu, or that's it for the year.
How do those figures, those 10,000 deaths, compare to the kind of numbers that we saw, for example, in some of the developing countries?
It's much harder to count in the developing countries, but in some areas, I'm familiar with flu coming to isolated villages in the Amazon, and those were isolated people who had never seen flu before, and it was killing people. It was a killer.
And did they have any kind of immunity even to the regular or the normal flu, if I can put it that way?
They had very little immunity, and that's why it was a killer.
Right.
So this one just penetrated all over the globe. You know, if 50 million people became infected here in the United States, probably 1 billion people have become infected with this virus this year.
So what are your greatest concerns then going forward into 2010?
Well, the first question is this one coming back in the spring? Is it going to come back in the summer? Is it going to come back next winter? And when it comes back, will it just be milder? Will it just be average flu? Or will we still have the concern that it might be a little more dangerous than usual? Although up to this point, the main danger was because it affected so many young people.
All right, thank you very much for joining us.
My pleasure.